Assalamualaikum and hi everyone. We are from AM238 1D, Group 2, are going to present to you our infographic poster which is about National Cancer Society of Malaysia.
Before we start, I would like to introduce our beloved group members that have been working really hard to finish this task. From the left, my name is Siti Nur Aida Suryani binti Mohta, Nur Alifa Ilyana binti Osman, Nur Hasha Fariha binti Muhammad Zainul Abidin, Sofia Natasha binti Muhammad Nazrul Hisham, and the last one, Nur Fatiha Izzati binti Muhammad.
So, this is our infographic poster. In this poster, we have included 5 aspects which are leadership, decision-making approach, challenges, effort taken, and CSR.
I would like to introduce about NCSM. The National Cancer Society Malaysia, NCSM, is a non-profit organisation dedicated to combating cancer through awareness, education and support services. With a mission to reduce the impact of cancer, NCSM strives to enhance public understanding of the disease while providing vital assistance to individuals affected by cancer in Malaysia.
Leadership within the National Cancer Society of Malaysia (NCSM) involve guiding the organisation toward its mission of addressing cancer-related challenges. Effective leadership in NCSM will entail setting clear goals, fostering collaboration among staff and stakeholders, advocating for policies that benefit cancer patients, and adapting to the evolving needs of the community. Strong leadership in NCSM is crucial for driving initiative, mobilizing resources, and creating impactful programs that support cancer prevention, treatment, and support services in Malaysia. There are 2 types of leadership style being practiced in NCSM. One is the visionary approach. In the context of NCSM, being visionary would involve having a forward-thinking approach toward addressing cancer-related issues. This would include adopting innovative strategies, embracing advancement in cancer research and treatment, initiating proactive awareness campaigns, and developing comprehensive support systems for patients and their families. A visionary approach within NCSM might also involve visionary long-term goals and solutions aimed at reducing the burden of cancer, enhancing access to quality care, and promoting overall well-being within the Malaysian community affected by cancer. 2 is the democratic approach. Within the NCSM, it could be involve various stakeholders such as healthcare professionals, patients, caregivers, researchers, and community members in the decision-making process related to cancer awareness, prevention, treatment, and support services. This might include initiatives like open forums, consultation, and participatory programs that allow input from diverse perspectives to shape policies, services, and advocacy efforts concerning cancer care and support within the Malaysian context. By embracing a democratic leadership style, the NCSM can leverage the collective wisdom and expertise of its stakeholders to make informed decisions and create impactful initiatives in the fight against cancer in Malaysia. In conclusion, these leadership styles within the NCSM prioritize inclusivity, open communication, and transparency. By valuing the input and perspective of various stakeholders, this leadership approach fosters collaboration and empower the organization to make well-informed decisions, implement effective strategies, and provide comprehensive support to individuals affected by cancer in Malaysia.
So today I'm going to talk about the decision-making approach in National Cancer Society Malaysia. So what is decision-making approach? Decision-making approach is like a way of figuring out what to do when you have choices. It's how you think about options, consider information, and finally pick the best course of action. It could be based on thinking logically, going with your gut feeling, or involving others in your decision. At the heart of this esteemed organization is a commitment to combat cancer through informed and strategic decision. The National Cancer Society Malaysia employs a collaborative decision-making approach involving experts from various fields such as oncology, public health, and research. This ensures a holistic perspective that addresses the multifaceted challenges by the cancer. NCSM also employs evidence-based practices across various phases of its mission to combat cancer. In cancer prevention, they rely on epidemiological studies and clinical trials to identify risk factors and develop target intervention. In treatments, decisions are guided by the latest research on the efficacy and safety of various therapeutic approaches. Support programs for cancer patients and their families are designed based on the psychological research, ensuring holistic care. Continuous monitoring and evaluation of these practices help the society to adapt more and improve, exemplifying a commitment to evidence-based excellence in the fight against cancer. Moreover, the National Cancer Society Malaysia values inclusivity in decision-making, recognizing the importance of incorporating the perspective of patients and caregivers. The patient-centric approach ensures that the organization's efforts align with the real needs and experience of those affected by cancer. In conclusion, the National Cancer Society Malaysia has practiced the best decision-making approach as stated just now. By leveraging expertise, staying informed, and engaging stakeholders, the organisation stands resilient in its mission to reduce the burden of cancer in Malaysia. I think that's all from me. Thank you.
I would like to continue our presentation with the challenges that are faced by National Cancer Society in Malaysia or NCSM. Before that, I want to explain what is challenges in general. As we know, challenges are obstacles, difficulties, or tasks that require effort to overcome or accomplish. They are exist in various aspects of life, presenting opportunity for growth, problem solving, and learning. Let's see what are the challenges that are faced by NCSM. The first challenge is funding. Non-profit organizations often face challenges in securing adequate funding to support their program and initiative. The funding is important to NCSM because cancer treatment can be costly and patients often face financial challenges related to medical expenses. This is also because commercialization of the healthcare industry that is increased. So NCSM tried to find funding to help cancer patients who cannot afford to pay the treatment. That's why the funding is important for cancer patients to have NCSM service. The next challenges that are faced by NCSM is public awareness. For the NCSM, raising public awareness could be challenging due to factors such as cultural barriers, limited resources, or a lack of widespread understanding about cancer prevention and early detection. For example, limited resources for NCSM could pose challenges in terms of funding, manpower, and infrastructure. This constraint might limit the organization's ability to expand outreach program, conduct research, or provide extensive support service. Besides, advocacy is one of the challenges that are faced by NCSM. Overcoming these challenges involve navigating potential resistance or difference in advocating for policy changes, public health initiatives, and increased resources for cancer-related programs. Indifference in advocating for policy changes could imply a lack of engagement regarding the challenges and priorities related to cancer. It might hinder the society's effort to influence policies that address crucial issues such as funding, prevention, and access to healthcare service for cancer patients. Last but not least, another challenge that NCSM faces is equitable access. These challenges can impede the society's effort to ensure that individuals affected by cancer have timely and equitable access to essential medical service, diagnosis, treatment, and supportive care. This includes overcoming challenges such as geographical barriers, financial constraints, and ensuring that all individuals, regardless of their background, have fair and timely access to comprehensive cancer care service provided by NCSM.
So now, I would like to present about efforts taken by NCSM. But first thing first, what is efforts taken? Efforts taken refers to actions
initiatives or steps that have been actively pursued or implemented in order to achieve a particular goal or address a specific situation. It implies the application of energy, resources, and commitment toward a purposeful endeavor. Efforts taken can involve a range of activities, from simple tasks to complex strategies, and they are generally undertaken with the intention of making progress, solving problems, or bringing about positive change in a given context. The National Cancer Society of Malaysia (NCSM) is a non-governmental organisation that is dedicated to the prevention, early detection and treatment of cancer in Malaysia. In order to achieve its mission, NCSM has taken numerous efforts over the years to raise awareness, support cancer patients, and conduct research on the disease. One of the key efforts of the NCSM is fundraising initiative like many non-profit organizations. NCSM likely engaged in fundraising activities to secure the necessary resources for its program and services. NCSM likely relies on donations from individuals, corporations, and philanthropic organizations to support their cancer-related programs and services. They use online platforms and crowdfunding campaigns to reach a wider audience and collect donations from individuals who support their cause. Other than that, NCSM also organizing events such as charity walks, runs, galas, or awareness campaigns to help generate funds. These events often involve community participation and support. Other than that, raising awareness cancer among the general public. The society organizes various campaigns and programs to educate people about the risk factors, symptoms, and importance of early detection of cancer. For example, they conduct awareness talks and health screenings in schools, workplaces, and communities to reach a wide range of individuals. Through these efforts, they aim to reduce the stigma surrounding cancer and encourage people to seek medical help at the earliest signs of the disease. Furthermore, the NCSM is actively involved in research and advocacy to improve cancer care in Malaysia. They collaborate with other organizations and research institutions to conduct clinical studies and promote evidence-based practice in cancer treatment. They also advocate for policies that will improve access to cancer treatments and support services, as well as campaigns to reduce the use of tobacco, which is the leading cause of cancer. Through their research and advocacy efforts, the NCSM strives to enhance the quality of cancer care and reduce the burden of cancer in Malaysia. Additionally, the NCSM provides support services for cancer patients and their families. They have a cancer information service that offers counseling, information, and referral services to those affected by cancer. Moreover, they run a cancer and health screening clinic which provides low-cost or free screenings for breast, cervical, and prostate cancer, allowing individuals to detect the disease in its early stage when it is most treatable. By providing these support services, the NCSM aims to alleviate the emotional and financial burden faced by cancer patients and their families. In conclusion, we extend our heartfelt gratitude to the National Cancer Society of Malaysia for their relentless dedication in the battle against cancer. Your commitment inspires us all, and we stand united in supporting your noble mission. That's all from me. Thank you.
Next, I would like to explain about CSR. The main point of the text CSR, or Corporate Social Responsibility, is a business approach where companies take responsibility for their impact on society and the environment by incorporating practices that contribute positively to society, such as ethical business practices, environmental sustainability, philanthropy, and community engagement. Companies that adopt CSR initiative aim to go beyond maximizing profits and consider the broader implication of their activities, recognizing the importance of being socially and environmentally responsible for building a positive corporate image and maintaining long-term sustainability. The first CSR is the Rotary Cancer Welfare Fund. It provides financial assistance to underprivileged cancer patients and their families, with a focus on early-stage cases and those who are breadwinners in their family. This fund has greatly benefited patients with their treatments and helped cover daily living costs, housing rentals, and school fees for their children. Next CSR is the Young Cancer Survivors Group. It was established in 2016 to provide support and a platform for young cancer patients and survivors to share their journey and obtain peer support. The group meets monthly and participates in various activities and workshops, including National Cancer Survivors Day, to help survivors stay well after cancer. And the last CSR is the National Cancer Society of Malaysia, NCSM, utilized the Direct Donor Debit Program, DDDP, to raise funds and support their mission of providing cancer education, care and support services. Through face-to-face fundraising, NCM aims to establish long-term relationships with donors and generate reliable support for their neighborhood. DDDP offers a convenient and consistent way for individuals to contribute to the fight against cancer.
At last, we all believe that this company has provided the best example on how good management works. We hope that this presentation can help you to understand more about one's company management. Therefore, that's all from us. Thank you. Bye!